All right, welcome everyone on this beautiful sunny morning in Melbourne. This is our webinar that we're holding this morning for the Nourish Network, and we're looking at nudging sport and recreation to promote water in sport. So just to give you a little bit of an overview, the Water in Sport initiative commenced in January 2018, which with funding from provided by VicHealth to 8 local government areas to each employ a project officer for a 2-year period. Project officers were responsible for facilitating the implementation of one of 2 nudges in a number of council-owned or managed sport and recreation and club facilities in each local government area. Nudges were intended to increase the provision and purchasing of healthier drink options and consisted of either 1, limiting sugar sweetened drink to display to less than 20% of display space, or 2, removing sugar sweetened drinks from display. Okay, let me just check with some housekeeping items. So during presentations, if I can ask that people keep their microphone on mute and their camera off. And if you have any questions, we'll cover those at the end. So pop them in the chat box as we go, or you can raise your hand and you'll be invited to speak during question time. So this is our agenda for the day. So we'll do the acknowledgement of country, and then we'll start with Tara Hennigan from VicHealth. And Tara will be looking at the motivation for the Water in Sport project and an overall project description of what it was and who was involved. And then Kate Wilkinson from the Healthy Eating Advisory Service will detail the changes made and the supporting positions. And then we'll have Eva Nikolitsis from the Frankston City Council and Peninsula Health and their experience of participating and engaging retailers. And then Miranda Blake and Devorah Risenberg from Deakin University will be discussing what the evaluation found and key lessons learnt. And then after that, we'll have a panel with speakers and any questions from the audience that you may have, and then we'll close. So acknowledgement of country. We acknowledge the traditional owners of country through Australia and recognise their continuing connection to land, waters and culture. We recognise that country has always been a place of sharing, teaching and learning. We pay our respects to elders past, present and emerging, and extend our acknowledgement to any Aboriginal and Torres Strait Islanders with us today. Okay, thank you. And I hand over to Tara Hennigan from VicHealth.
Thanks, Victoria. Hi, everyone. I'm Tara, and I'll be providing some context for Water in Sport, including an overview of the project and a brief outline of the toolkit for creating healthy food and drink environments in community food retail outlets. So VicHealth has a long history supporting a variety of settings, including local governments, sports clubs, associations, and sport and recreation facilities to create healthier food environments within their sports venues. And these partnerships over the years have had varying levels of success, which are covered in greater detail in the Healthy Food and Drink Choices in Community Sport resource, which is available on the VicHealth website. However, the 3 consistent challenges that made it more difficult to implement or maintain these changes were that 1, volunteers and paid staff in sports settings are often heavily focused on the day-to-day logistics and lack the time to prioritise this type of work. 2, they lack the capacity to make healthier food and drink changes on their own. And 3, even when positive changes were made during the funding period, they were not maintained long-term due to lack of oversight and governance. The Water in Sport project built on these learnings and outcomes from these investments to influence water as the beverage of choice in council-owned sporting environments. The Water in Sport project ran from 2018 to 2020 and was an investment underneath the VicHealth Healthy Eating Strategy that aimed to improve the availability and promotion of water instead of sugary drinks in council-owned or managed sports and recreation facilities. And I'll provide further detail for the aims of this in the next slide. Sorry, go back, Victoria. Thanks. Increasing access and supply of water instead of sugary drinks is a significant first step to implementing the Victorian Government's Healthy Choices Guidelines, which are a set of guidelines that support implementation of healthy foods and drinks in key settings, including sports and recreation centres. Water and sports, sorry, Victoria, thanks. Water and sport was a $1.2 million investment over the 3-year period, and project partners and key roles were set prior to the establishment of council partnerships. Key project partners were Deakin and Heath, with Deakin overseeing the evaluation and providing support to council project officers and data collection, and Devora was the key point of contact for the project officers. And Heath provided the expertise to the project officers to build their capacity in policy change and also implementing the Healthy Choices guidelines in their facilities. And Kate was the key point of contact from Heath. And then as for VicHealth, I was the main project lead and provided broad project oversight and management of the project. Thanks, Victoria. In selecting council partners, councils across Victoria were invited to submit an EOI and were assessed according to their CFA, rates of dental decay in children, and rates of overweight and obesity at an LGA level. In the applications, we also asked for commitment from council leadership to undertake this work and to provide an outline of how they would sustain the changes through policy and/or procedure change. And we also recommended that references were received from participating council-owned sports and recreation facilities. This was built in with the aim of selecting councils that were engaged and committed to creating healthy drinks changes in their facilities from the outset. And we also focused on council-owned facilities, as councils have a greater degree of oversight and governance of these facilities. We partnered with 8 councils across Victoria, which you can see in the map there to the right, and each received differing levels of funding. The majority of the funding was utilised to employ a project officer to deliver the project and oversee the management. And the FTE varied across the councils depending on the number of facilities, but on average, the project officers were working around 2 to 4 days per week. And each project officer worked with a variety of settings, and this ranged from really large sports and recreation facilities to your smaller sports clubs. And there were 2 key aims of the water and sport project in the councils. And the first was around increasing the promotion and supply of water and reducing the availability and supply of sugary drinks in the retail outlets of sport and recreation facilities. So this was really, this aim was around changing the drinks environment in the retail settings. And Kate will go through what that looked like in her presentation. And the second was to develop or strengthen council policies and practices to enable longer term changes to increase the promotion, access and supply of water across council-owned sport and recreation facilities. And this was essentially policy change to sustain these changes in the long term beyond the investment period. And Eva will be discussing the policy that Frankston created in further detail in her presentation. Next slide. Miranda and Devora will be providing more detail about the results of the project, so I won't focus on them here. But at the end of the project, we had some really rich learnings and insights. The evaluation report was very comprehensive and quite long, so the decision was made to create a resource that was concise, easy to use, and supported practitioners to create healthy food retail environments. We actually launched this recently alongside infographics that provide an overview of the key results in each local council. I do encourage you to take a look at these, as you might find them useful in supporting your own work. But to wrap up, water and sports, massive piece of work, and I'm really proud of the changes that the project officers made across each of their councils, and also the collaborative team that Deakin, Heath and VicHealth formed. Thank you.
Thanks very much, Tara. That was fantastic. And like I said, if anyone has any questions, please pop them in the chat box and we'll look at them at the end. And welcome to Kate Wilkinson from the Healthy Eating Advisory Service. Thanks, Kate.
Thanks, Victoria. So Heath, we're really proud to be involved with this project and work closely with VicHealth and Deakin to deliver some great outcomes in all of the 8 LGAs that were involved. So the facilities that were involved with the Water and Sport project were tasked with implementing one of 2 nudges to encourage customers to choose water over sugary drinks. And these nudges were chosen based on some previous evidence and research that was done through VicHealth that showed that these were the most effective nudges in terms of shifting customers towards purchasing healthier drink options in these facilities. So the drinks were classified using the Victorian Government's Healthy Choices guidelines, which uses a traffic light system to classify foods and drinks based on their nutritional value. So for example, green drinks such as water are classified best choice. Amber drinks such as diet soft drinks and fruit juices are those to choose carefully, and red drinks such as sugar sweetened drinks are those to limit. So the two nudges were either to limit red drinks or to take red drinks off display. So in terms of limiting red drinks, these facilities were required to have their drinks fridges providing no more than 20% red drinks in the fridges, and also have at least 50% green drinks available as well. For the red drinks off display nudge, we did not have a percentage target in terms of red options there, but they were required to have all red drinks either removed from display via just taking them out of the fridge and placing them elsewhere, or remaining in the fridge but covering up with posters or decals so they weren't actually visible to customers. And then of the drinks that were on display, they also had the target of having 50% green options there as well. And the amber drinks just made up the remainder of the fridges once these targets were met. So in terms of how the project officers went about implementing these nudges, so the project officers in each council worked really closely with their facilities to implement and maintain the nudges throughout the course of the project. So initially the project officers completed baseline assessments of all their facilities' drinks fridges using the HEAS Food Checker tool, which is our online menu, product and recipe assessment tool. So project officers used Food Checker to generate reports with classifications of each of the drinks being sold in the fridges and overall percentages of green, amber and red in the fridges as well. So project officers then worked closely with their facilities and negotiated what changes to make in these fridges in order to meet those nudge targets. So that includes discussing which of the unhealthier drinks they might remove or change, as well as what healthier drinks they might introduce as well. And then project officers completed regular follow-up assessments in their facilities to track progress and maintenance against those nudge targets as well, to determine when the nudge was actually met, and that information fed into Deacon's evaluation of the project as well. So as mentioned, so HEAS was tasked with providing support to the workforce, which were the project officers implementing this project in the 8 councils. So that was not only to implement those nudges, but also to meet the requirement of developing a healthy drinks policy for their councils as well, to make those changes more sustainable in the long term. So the support provided included training to build their capacity to work with their facilities as well as within their councils as well. Regular phone and email advice was provided to all the project officers, as well as individual face-to-face meetings at the councils every 3 to 4 months. So we also established a community of practice to bring all 8 project officers together every 6 months throughout the project. And that was to help build relationships between the project officers and help them to network with each other. And I guess most importantly, it was to share their learnings and resources with each other to help them achieve their goals. A private Facebook group was also established to encourage connections in between those face-to-face community practices as well. And we also introduced some 6 weekly phone calls throughout that time as well. HEAS also provided a number of new project-specific resources to help them with their work, as well as some existing HEAS resources to help them achieve the goals of the project as well. So just, a bit more detail in terms of the support provided for the nudges. So the training that was provided around these nudges was to, teach the project officers about the healthy choices guidelines and specifically the drinks classifications that they were using with the nudges. And also how to go about achieving those nudge targets, so how to work with their facilities to make changes there as well. We supported them with their use of Food Checker and assisted them with completing assessments where needed, as well as how to use the product assessment function of Food Checker to help them identify some healthier drink options that they could potentially supply in those facilities. We also helped the project officers to troubleshoot any issues they had with meeting those nudge targets as well. So that involved things like contracts with the drink suppliers that limited their ability to make changes with what was being provided. Sourcing some of those healthier options where supply was limited, particularly in a lot of the regional LGAs that were involved, and also working with the canteen staff. So as mentioned, there's volunteer run, quite a high turnover of staff within canteens in these facilities, and often issues with those volunteer run canteens sustaining those changes in the long term. And then in terms of the support provided around the policies and contracts, so to support them with developing a healthier drinks policy for their council, he's provided them training around the policy development cycle and all the elements they need to consider when developing a new policy, including stakeholder consultation, as well as getting management approval for that as well. So we provided them with a few different resources to help them identify some existing policies and contracts within their councils that they might need to influence, as well as templates for wording that they can insert into their own documents, so their own policies and any food service agreements for the facilities as well. We also provided them feedback on their policy and procedure drafts throughout the project as well, to ensure there was alignment with the Victorian Government's Healthy Choices policy, and help them to troubleshoot any other issues around some other parts of councils providing negative feedback or challenging the development of the policy during that process, as well as helping them to tailor their policy and their contracts to the council situation where that was needed as well. So just in terms of anyone who might be watching today who's from sort of other councils who might be looking at our toolkit that we've developed and starting to think about taking on a project like this within your area, there's probably just a few things that we would suggest being prepared for in terms of some of those challenges at that sort of broader, higher level. Eva's also going to go into some details about some challenges and how she overcame those within the actual facilities as well. But overall, I guess with this project, we found that staff recruitment and turnover was a bit of an issue throughout the project. So delayed council recruitment processes slowed the commencement of the project for a few of the councils, and also turnover of the actual project officers throughout the time as well impacted on that ability to meet the nudge targets and those existing relationships with facilities, as well as progressing with the policy development as well. And also limited resourcing in some of the council areas for the project officers, where if they're only working sort of 1 to 2 days a week on the project, meant that they had limited time to actually go out and meet with the facilities or interact with them and develop those relationships and progress a lot of that work. So that was a bit of a limiting factor there. And also just generally the council development policy processes impacted on that ability to get timely approval and endorsement. Like for example, those councils that were getting approval from the actual councillors experienced delays due to trying to get on their meeting agendas was often a bit of a challenge. And some of the councils also were required to do multiple rounds of community consultation with their policies as well, which further delayed the implementation and approval of that. So I guess where possible, we'd suggest ensuring that you're adequately staffed for the required deliverables of your project, and also factor in those council approval processes when developing your timelines as well, and allowing as much time as possible. So I guess, HEAS has a long history of supporting sport and recreation facilities and councils with encouraging healthy eating in their facilities, and I've worked quite closely with VicHealth on a lot of these projects in the past. So please reach out to us if you'd like any further support with this work in your local area as well.
Thanks very much, Kate. Excuse me, thank you. And so great to hear some of the practical suggestions for implementing this initiative. All right, next up we have Eva Nikolitsis from Frankston City Council and Peninsula Health. Thanks, Eva.
Thanks, Vic. So I had started on the Water and Sports project back early in 2018 and was seconded from Peninsula Health on a 2 days a week basis as the project officer at Frankston City Council. Within the project, we had numerous different facilities being involved, so which varied from large recreation and leisure centres that had over 1 million visits per year, down to smaller sporting clubs that were generally run by volunteers. So it was a large variation working with all these facilities, and then the support was tailored as well. Just in terms of some day-to-day work that would be required of a project officer, there was numerous different tasks that would take place. One of them would be liaising and communicating with the club facilities, simplifying some information to them, providing tasks that were broken down into easier steps, and consulting with the recreation team if any difficulties had arisen. I would also work to rate the menus and complete food checker reports, assisted with data collection, which Deacon would speak to next. That includes stuff such as surveys and photo audits, as well as collecting some sales data. I would also develop some resources that would help to support and make things easier for the centres. So fridge decals, which would be used as posters to cover up some of the red drinks, some of the planograms, which is the image on top there. So basically that was just simplifying and breaking down each specific fridge to help the centres work out how to meet the nudge. I would also be attending the community of practices that were run by the project partners, and this was really helpful as we'll be able to share some of our learning and experiences with the other project officers. And lastly, we're creating policies and procedures to ensure the sustainability of the project post-funding. In terms of engaging retailers, the best approach I found was to firstly, when I was meeting with them, provide them with some case studies, whether that be from existing HEAS or VicHealth resources that are online. And this was pretty much to show them and to prove that this sort of nudges and works within that particular setting. And it just gives them more confidence to kind of make those changes without altering or impacting their sales. So basically what we would do is start with some small and quick, easy wins that were selected together. So things such as moving, the healthier drinks more in line of sight, and the unhealthier ones out of reach or behind posters. Again, I would provide some useful resources to make the job easier for the centres, and that would help to kind of build that relationship as well. And just continuing throughout the entire process with ongoing support, whether that be from continually providing them with some new healthier drink products that we had sourced. If they had found something that they'd like to try, rate that for them and provide them with some feedback, and just having chat with suppliers if need be as well. In terms of some challenges that I'd come across within the project, one of the main ones was that the fact within the sporting club setting, it is mainly volunteer run. So it was sometimes difficult to reach the sporting clubs and secure meeting times, knowing that they had other jobs that they were obviously sometimes they were a bit time poor in that sense. We had to kind of reach them out of hours as well. And just from experiencing different levels of engagement from the sporting club committee and the volunteers, that also have sometimes turnover from one season to the next. So a way that I kind of look to overcome that is within the new season that I'd kind of chatted to the whole committee at once, whether that was from a committee meeting that I attended out of hours, just to ensure, that there was buy-in from the start and that everybody was on board. So if someone wasn't reachable one week, someone else may be, and if there was turnover, the whole committee knew what was going on as well. The other challenge that I'd kind of come across as well, which was more so in the leisure centre space, was contracts with suppliers. So some of the facilities had contracts with particular suppliers, and they obviously only had a certain amount of availability of healthier beverages within their supply range. So we kind of had to work with what was provided, as well as the fact that within these contracts, they would only allow for a certain amount of percentages of other alternative drinks not within their supply range to be stocked within the fridges. So it's just working with these suppliers and, ensuring that we're meeting these percentages, but also ensuring that we're meeting the nudges as well. Thanks, Vic. As mentioned, towards the second half of the project in the year, a major aspect was also focused on developing healthy choices food and drink policy. And we achieved this. There's quite a lot of work that went into this, and I guess there was multiple steps that took place, and we were lucky that we had within our municipal public health and wellbeing plan, healthy lifestyles as well as healthy eating was a main priority. And within numerous year 2 action plan, I believe it was more specifically stated that we would be working on a healthy choices policy for council. So in terms of the process to get the policy endorsed, we had a cross-council working group that was developed, and we had numerous and various departments a part of this working group that kind of gathered together at numerous different occasions to discuss the scope of the policy, the principles, the details of what would be included within it, and mainly to work to make sure that it was suitable for all different council departments as well. We also then had consultations with different management and at the director level as well to ensure that it's suitable for their needs and that they would take it on board once it was endorsed. And again, had numerous different opportunities for community consultation. So I believe ours went out for community consultation twice. And in January of 2020, it actually got endorsed by council. In terms of policy implementation, the way that Frankston City Council went about it was we introduced 3 broad categories, which was broadly based on the setting complexity and the level of council influence, and the amount of control that we'd be able to have over particular settings. So mainly any setting that was within category 1 or 2 had a higher level of council influence and or complexity. And then the category 3 settings were provided with a healthy food and beverage guideline and was more so just as a recommendation, and it wasn't necessarily enforceable within the policy. So they were provided with some information, but within the category 1 and 2 settings, they were required to develop their own healthy choices procedures to showcase how they were going to work towards the policy. And again, there was support with Peninsula Health to develop these policies as well. The procedures within the given setting. If anyone would like any further information regarding the policy or any of the topics that I discussed, I'll shoot my my email address within the chat function so people can feel free to get in touch afterwards as well. Thank you.
Thanks so much, Eva. Yeah, fantastic. Once again, really great advice in terms of implementing our healthy eating initiative. And for our final presenters from Deakin University, we've got Miranda Blake and Devora Risenberg.
Awesome. Thanks, Victoria.
Thank you.
So as Victoria said, Miranda and I will be speaking about the evaluation. Next slide, please. Thanks. So as you can all see, this was quite a large project. So obviously we had quite a large research team involved. So I just wanted to start by acknowledging everyone's input in the project. Next slide, thanks. Thanks. So as part of the water and sport evaluation, we had a number of different types of data sets for the evaluation. This included photo audits to monitor the food and drink changes, customer, staff and project officer surveys to monitor progress. And we also conducted 2 local government surveys, one in Victoria in 2018, and then one 2 years later. And because of, I guess, the great feedback we got from the 2018 one, we decided to invite the entire Australia to be involved in this one. And this was a survey to identify any healthy food policy and healthy changes made in sport and recreation facilities, amongst other things. And we've just sent out some reports to the different states and local governments that were involved. So if you do have any questions about that, feel free to get in touch. But for the purpose of this webinar, we're going to be focusing on the bottom 3 data sets that we used, which was the sales data, the focus groups, and the stakeholder interviews. But the full report will eventually be on the VicHealth website, or feel free to get in touch with Miranda, myself, or Tara if you did want to see it before that occurs. So for the weekly sales data, from November 2015 until February 2020 were analysed to evaluate the impact of the initiative on the relative healthiness of drinks sold. So this included changes to the red, amber and green drinks, as well as the drink revenue. So sales data was separated into seasonal and non-seasonal facilities, and also then analysed separately as they just had different patterns. So the seasonal facilities typically involved outdoor pools, and the non-seasonal facilities were generally those larger like leisure centres or court type facilities as well. So for the 8 seasonal facilities included in the analysis, we calculated and compared the average sales outcomes before and after the initiative, including 1 season before and 2 seasons after. So we found that there was a reduction in the average percentage of red drinks sold after the initiative of about 22%. And then we also saw a 13% increase in the average percentage sales of amber drinks after the initiative was implemented. And for the green drinks, the percentage of green drinks increased about 10% after the initiative. And the good news is there was no change in weekly revenue. So for the 10 non-seasonal facilities included in the analysis, we estimated the difference between what actually happened and what would have happened if the initiative never occurred to determine the impact of the initiative of each of the 10 non-seasonal facilities. This analysis also took into account whether sales was increasing or decreasing prior to the initiative starting. So for the results, the percentage volume of red drinks sold in February 2020 decreased in 6 of the 10 non-seasonal facilities. And this decrease ranged from about a decrease of 50% to a decrease of about 10%. The percentage volume of amber drinks sold increased in 5 of the 10 non-seasonal facilities. And this increase ranged from about 5% to about 33%. And then with the green drinks, the percentage volume of green drinks sold increased in 4 of the non-seasonal facilities, and this ranged from about 10% to about 20%. There was a decrease in 1 facility in the green drinks and no change in 5 facilities. And then with the revenue in 9 of the 10 facilities, there was no weekly change there was no weekly change in the drink revenue. And now I'll pass you on to Miranda, who'll be discussing the staff surveys, the interviews, and the focus groups.
Thank you, Devorah. So I'm going to provide an overview of the qualitative evaluation. And as Devorah said, that includes different qualitative methods we've used to understand the factors that may have helped or hindered the Water and Sport project. And so that included surveying the project officers every 6 months during the project. We also included a focus group of project officers, VicHealth and Australia representatives. And finally, we had 15 interviews with VicHealth Australia representatives and also local government managers, outlet managers, and project officers as well. And so we've highlighted some of the key evaluation findings with quotes here, and I'll let you read the quotes as I summarise. So our results highlighted the perceived value of the Water and Sport project for stakeholders, in particular, the importance of funding for allocating a project officer who could focus on the project. So this project officer was important in providing tailored, individualised support to facilities to help them overcome and address their individual challenges and also capitalise on the opportunities relevant to their particular context, customer base, etc. The support from, The support from the Health and Advisory Service and Deakin was really key as well in terms of providing that external expertise in implementation at a local government level and how to evaluate and get rigorous feedback for those facilities and councils on their progress. Stakeholders also highlighted that maintaining the nudges may require both ongoing human resourcing, so continued project officer support, as well as recognition of those facilities that have made positive changes. So this could be, for example, through media or promotion or through some kind of award or accreditation scheme. Next slide. So based on what was done well in the Water and Sport project and to be replicated, and some of our reflections and the reflections of stakeholders on what could be improved for next time, we have put together 12 recommendations. And if you would like to see the 12 recommendations, you can go to our full evaluation report, which we'd be happy to send you. But here I've just provided 3 key recommendations. So for the implementation support agencies, that's your healthy and advisory services, It's really important to support project officers with targeted training and also general project management skills. So this includes things like policy development, system thinking, strategic planning, time management, basic evaluation skills, as well as targeted training, for example, in retailer engagement and marketing within a retail setting. For local governments or facilities or other community organisations who are looking to make a healthy change, we recommend by starting with trialling a quick small win. These are things that are easy to implement and are unlikely to have negative consequences like revenue loss. So for example, it could be rearranging the fridge to put green drinks to eye level. And the advantage of starting with these small trials is that helps to build momentum in the project to go on to more ambitious next steps. And then finally, for the convening agencies, this is a funding agency like VicHealth, we recommend maximising the funding usefulness by ensuring funding can be flexible to tailored opportunities in each local government. So this may be allocating most of the funding to salary, but also providing flexibility to capitalise on opportunities like, for example, infrastructure requirements within facilities. And finally, it's also need to consider the support through funding or other mechanisms for longer term maintenance in those settings. Next slide. So for those of you who've been inspired by what you've heard today, we encourage you to go to the VicHealth Water and Sport website to see the toolkit and associated case studies and infographics. Soon we'll have the evaluation report on there too, or if you're really desperate, you can email Deborah or myself for that in advance. And you can also go to the HEAS website for further information, case studies, and you can contact HEAS for tailored individual support as well. And now I think we're going to open up for any questions.
That's right. Thanks so much, Miranda and Deborah. So if anyone has any questions for the presenters, please feel free to jump in, unmute yourself, or pop a question in the chat and I can raise it. No questions? All right, well, I actually have some that I've been sent through previously, so I'll share those with you now. I have a question for Eva. Have facilities, the sporting clubs and leisure centres, sustained their positive changes since the project has finished? If Eva, you could answer that question, that would be great.
Thanks, Vic. Yeah, so throughout the project, we tried to ensure as many tools and resources as possible to ensure that it will be sustainable post-project funding. We incorporated some wording within the seasonal tenancy agreements, the resources such as the fridge planogram, and the decals. So as well as the policy and the drink management procedures as well, we'd hope that the leisure centres and the facilities would be able to sustain the changes. However, COVID did have a bit of an impact in this. So post-COVID, a lot of the clubs and the facilities were just in a bit of a recovery phase. They weren't necessarily opening the full canteens or reducing the hours. So we're still yet to see the longer term sustainability of the project just because of COVID having a bit of an impact in that situation. But yeah, we're always open to continuing to assist the clubs and provide support when needed. So yeah.
Awesome. Thanks so much, Eva. I see we have a question from Anna Peters. Thanks, Anna. Anna's asking to all speakers, are there plans to continue to build on the water and sport across the state? If one of the presenters would like to jump in and answer that, that would be great.
I might provide a response from VicHealth. So we are about to announce partnerships with 17 local governments to support them with initiatives to increase the health and well-being of their community. Part of that, there'll be, I think we're referring to them as health promotion modules, but there'll be a number of modules across a variety of different focus areas. But one of those will be around creating healthier food systems with a focus, one focus on improving the food and drink environments of council-owned settings. So this will go beyond your sports and recreation facilities and be looking at, your libraries, art centres, basically anything that's council-owned. And the toolkit will be a key resource to support these councils to implement those changes, alongside, of course, support through the Health Eating Advisory Service. Yeah, that's happening from VicHealth.
Fantastic. Thanks so much, Tara.
I'll jump in as well. I might do a little plug. I've put into the chat box that, as well as Tara said, that Deakin will be a partner with VicHealth on their upcoming partnerships with their 17 local governments. And also Deakin is currently recruiting for 12 Victorian local governments to work with us, HEAST and VicHealth, on a new project called Promoting Change, which is looking at promoting healthy food retail in local government facilities. So if you'd like to find out more about how to get involved with that, you can feel free to email me, or I've put a link in the chat.
Brilliant. Thank you, Miranda. We've got a question from Jasmine Chan. She says, hi, Kate, you mentioned some negative feedback from other council departments were received. What was this feedback and how did you, the project officers, respond? Kate, if you can jump in, that'd be great.
Yeah, no worries. There was something that, not every council experienced this, but there was a couple of councils that, yeah, I guess when they put their policies out for broader consultation across other parts of the council, they had a bit of sort of pushback from. And it was mainly around the, I guess some parts of the council where they looked at their policy expanding beyond just their facilities, but also to staff catering and those sorts of things as well, like vending machines within council, operation centres and things like that as well. The main, I guess, pushback was around limiting the choice of people who wanting to access some of those unhealthier options. And yeah, I think there was also, generally, there's also a little bit of concern around the financial implications of some of these changes as well. So they were some of the main sort of negative sort of feedback on progressing with these types of policies. And the way that we, I guess, encouraged the project officers to look at that was to kind of just explain really the benefits of this policy and also to, I guess, bust any myths around the financial aspect of it, especially as well. We've got a lot of case studies and lots of evidence now, especially through a lot of the research that Deakin has done. And also what we found throughout this project as well is that there's, you can implement these changes without it being a loss to your organisation financially. And yeah, it was really just trying to encourage them to also work with their management to get their management on board to kind of have that top-down approach with, encouraging the council to be like, this is just the way that this council is approaching things now. This is, we're putting the health of our community and the health of our employees first, which is why we want to introduce these policies and have healthier options more available. So yeah, it was just sort of helping them to, I guess, understand how to best overcome those issues.
Really good question. And for Tara, question, is there still opportunity for other LGAs to get involved with the project for Tara?
Yeah, thanks, Victoria. The modules that are being currently developed will be available for all councils across Victoria to utilise. Yeah, I probably can't say too much more than that, but the intention is for them to be available and used.
Okay.
I'll just mention in relation to that as well that as well as that, we've also, HEAST is also able to support councils all across Victoria with this type of work as well. And I think that, yeah, a lot of those modules that VicHealth are producing will also complement some of the new learning and development that we're producing as well. So we just recently launched an online module for how to work with your management and getting your management on board, which is often a big barrier for these types of changes. And we'll be looking at introducing another one later in the year around policy development, as well as working with retailers as well. So no matter who you go to, I guess, with our organisations, there's always some level of support available to everyone.
Fantastic. Targeting it from all angles. Sounds good. And Melissa Farrington has asked, can the toolkit be used in non-council sport and rec facilities? If one of the presenters wants to jump in.
Yeah, sure. I'll jump in for that one. Yes, 100% the toolkit can be used in a variety of different settings. We kind of tried to keep it as broad as possible, but obviously we've taken our key learnings from this project. So there is I guess it was from that specific setting in the sport and rec centres, but we've definitely made an effort to keep them extremely broad. So yeah, feel free to give it a go.
Okay, and from Jothri to Tara and Miranda, are there plans in the new projects to assess whether the new projects within LGAs represent good value for money, i.e. a cost effectiveness analysis for Tara and Miranda?
I will need to pass on to Miranda. I'm not across the actual evaluation protocol for the local government partnerships, so I'm unsure.
I can't speak to the local government partnerships to that project, but I can say for the promoting change trial that we're currently recruiting for, absolutely, that's a key component, is looking at value for money at retail outlet level, and also for government. It does represent a good investment. Yeah, so that's one of the advantages of doing a really rigorous trial, is we can explore some of those questions to get really strong evidence to support these kind of implementation going forward.
Fantastic. Okay, I think we just have a couple more questions. I will have one for Hees and for Kate. What element of your program support was most effective in helping the project officers be successful in their work, and what was least effective in your opinion? Thanks, Kate.
Thanks. Yeah, I think from my perspective, yeah, I'm interested, I don't know if Eva thinks any differently, but from what we observed with the project officers, probably the most effective way of supporting them was the communities of practice that we established. So it was really great to see, I guess, the relationships being built between the project officers throughout the 2 years of the project. And towards the end, it was really them just giving each other ideas and learning off each other. And we just kind of facilitated the conversation. And it was really a lot more effective that way around. They could bring, you know, what they've experienced in their council, and someone else from another council could learn from what they've done. And also having those face-to-face communities of practices provided that option, I guess, for us to incorporate some training into that as well, which was how we best upskilled the project officers with the nudge implementation as well as the policy development as well. And then later on throughout the project, we also delivered some some systems thinking training through that with the help of Deakin too. So I think those sessions that we had with the project officers were really probably the most effective part for us. In terms of leave.
Oh, sorry, I was going to say I tend to agree with that. I think they were quite helpful. The face-to-face ones at the start were more so training, so giving us the tools that we needed to implement the project. But then towards the end, when we already had all that knowledge, it was really useful being able to speak to the other project officers. And if we'd experienced the same barriers, someone might have a solution that that we might not necessarily have thought of. And it was just really great to be able to workshop ideas as well. Sorry, Kate.
That's okay. In terms of the least effective, I think we trialed a private Facebook group for the project officers to connect in between those times, and we found that sort of didn't really take off in the end. So that's something, I guess, at HEAS that we're looking into around what we've also learnt from this project is looking at how we can facilitate a community of practice, not just for those 8 LGAs, but opening it up to the broader state. So anyone working with sport and recreation facilities is now invited to come along to our communities of practice for sport and recreation. So you can get in touch with us for that. So as part of that, we're also looking at, if there's any other ways, like any online forums or platforms that we can connect people with that would actually be worthwhile. It's not just something that's nice to have, but would actually be effective in helping with the work as well.
Okay, we have a question from Karen Knight. From a climate change perspective, is there any discussion with regards to doing this work without bottled water?
I'm happy to try and answer this one.
Kate.
So I feel like we do get this question quite a bit, I guess, with obviously for local government, climate change is a big issue that they're looking at addressing at the moment. And when you do see in these facilities the volume of bottled drinks that are often for sale, that is a big glaringly obvious thing that's now we're seeing. So that's something that I guess the Healthy Choices Guidelines has, is looking at, considering, but it's not something that that policy addresses very distinctly at the moment. I guess with this kind of work, it's really just baby steps. It's going from, the actual drinks fridges generally would have, 80 to 90% red drinks. So it's just initially shifting them towards having healthier drinks options there. Going from a full, having bottled drinks for sale to then no drinks for sale at all is quite a big change for a lot of those facilities. So if we can at least nudge them towards having those healthier drink options there, and also ensuring they've got, tap water available, they've got, water bubblers and things like that. So there's free water available for people as well. I think those steps in those right directions, and then eventually looking at limiting the amount of bottled drinks for sale and eventually is the right step to go to. But I don't think a lot of the councils are quite there yet.
Yeah. One thing that I could add to that as well, it was a question that I would get from some of the retailers that I was working with is, I guess the response that I would kind of come back with them is when they used to sell, say, 600, the larger bottles of soft drink, and we'd kind of try to reduce the serving size, and we'd go down to a can. So we are slowly reducing the amount of plastic in terms of the bottles. So even though we're promoting more water, we'd also look at, we are reducing the amount of bottles from the soft drinks, going from the larger volumes to the smaller quantities, as well as nowadays, the larger suppliers and the larger brands tend to have recycled plastics that are used within the bottled waters. So, trying to get some of the facilities to use ones that they have seen that are from recycled plastics, although it's not, the best way to go, we still encourage, refilling water from the tap and whatnot. If they still needed to sell water in their facilities, looking at who's got recycled plastics, as well as reducing soft drink bottles to cans can help to reduce the amount of plastic as well.
Okay, brilliant. I think we have time for one more question. This question is a fairly general one, good to end on. So the results of the water in sport have been very positive, including for the retailers involved, which is really, really important. What does the research tell us about interventions that are both effective at changing customer behaviour and good for retailers' bottom lines? So if one of the presenters would like to answer that one, that would be good.
I'm happy to jump in from a research perspective.
Thanks,
so at a high level, the kinds of interventions that work are the kind of interventions that facility managers and staff want to implement and that are appropriate for the context and customer base. So that's, I suppose, rule number one is you need to really think about, what's the goal here and what are the constraints and opportunities within the space. And another overarching thing the research tells us is thinking about this not just as a health problem, but as a business problem. And if you're working with facilities, then you'll know that the managers and staff there have a huge number of skills already. They know how to engage with customers, they know how to sell food. This is just turning those skills to a slightly new focus. So I think that's one thing. And then in terms of actual changes, as I said, starting small, trialing something, the evidence shows that's a stepwise implementation, definitely encourages further momentum. And then the more specific changes, again, you sort of have to work with your retailers and what do they think might be a good place to start. We've found that drinks are often considered to be an easier place to start. There are easy healthy swaps, for example, and there's pretty good evidence that those changes can be made in ways that customers find acceptable and are revenue neutral.
Great, thanks Miranda. So piloting the changes to help everyone ease in and get motivated, and then start with simple changes, maybe the key messages here. Okay, sorry, all right. So if we don't have any other questions, we've just got some great comments coming through in the chat. So thank you everyone for getting involved, and again a big thank you to all our presenters and our collaborators and everyone who was involved in this fantastic project. Amazing strategies and implementation that you've shared today. So we will make the slides and presentations available on the Nourish Network website, and I'll email you out the link if you would like to view it again, or feel free to send it on. And we're also going to issue a quick survey to understand what you gained out of the webinar and what potentially you'd like to hear in the future. And a plug from me, I'm the new Nourish Network Coordinator, Victoria Hobbs, and we would love everyone to join the Nourish Network if you're keen to improve healthy food retail. We're doing lots of great events, and there's also action teams where you can directly get involved in specific projects to help improve food retail as well. So if anyone else has any other comments, I think we will close the webinar, and thank you again to everybody. Okay, thank you.